Doubts have been raised this morning about Australia's COVID vaccination strategy, with medical experts warning that the AstraZeneca jab may not generate herd immunity against COVID-19. The vaccine is the centrepiece of Australia's strategy, with almost 54 million doses on order. But a number of doctors and immunologists are backing a call to suspend the planned rollout.
It comes as authorities in New South Wales and Queensland remain on high alert for the possible spread of COVID-19 cases. While thousands of Victorians are stranded in COVID hotspots in Sydney and Brisbane with no idea when they'll be able to return home. Straight to Alexia Attwood in Sydney, Michael Rennie in Brisbane and Beth Gibson, who is joining us from Melbourne. But Lex, let's start with you. Good morning once again. What have experts been saying about the AstraZeneca vaccine?
Morning, Georgie. Well, there are concerns from these infectious disease doctors that Australia is possibly relying too heavily on the AstraZeneca vaccine, that it's not effective enough to achieve herd immunity. There are concerns that the efficacy rate is only around 62%. Now, Australia has secured around 54 doses of this vaccine, which means that it's the dose that many Australians are likely to get. But there are a lot of doctors that want the government to work harder on securing other vaccines, the Moderna and the Pfizer vaccines.
There are all these sort of highly contagious strains that are emerging around the world. And we don't believe, based on our current data that was released by AstraZeneca at the end of December, that 62% is going to be adequate to achieve herd immunity.
Georgie, I have spoken to a spokesperson from AstraZeneca this morning, and they've told me that the Therapeutic Goods Administration is still needing to be considering the data. And they've said that they've always maintained that Australia should be pursuing a number of different vaccines in order to combat the global health emergency that we are currently facing. Now, the Federal Health Minister, Greg Hunt, has also just put out a statement. He said that AstraZeneca in late 2020 put out some data to show that the vaccine is around 70% effective and that it is working to combat the severity of the disease and avoid hospitalisations. And he said that Australia's decision to invest in vaccines is always being driven by a panel of medical health experts.
Well, another key to being able to control the outbreaks of COVID-19 is, of course, the number of people getting tested. What do we know at the moment, Lex, with the number of people getting tested in New South Wales?
Georgie, we know that the numbers are just too low. Yesterday we had around 14,000 COVID-19 tests done, and the government wants that to effectively double in order to be able to seek out the source of all these mystery cases that we have popping up across the city. In the last reporting period, we had 5 locally acquired cases. Only one of them was actually linked to the Baralla cluster, but the 4 others are still under investigation. That's the ones that we found out earlier in the week, the man who went to Mount Druitt Hospital and his wife, and also 2 more cases on the Northern Beaches, and they haven't been linked to the Avalon cluster either.
Let's go to Queensland now, where the race is on to determine just how the hotel cleaner at the centre of Brisbane's lockdown even contracted the UK strain of that virus. Michael, are we any clearer about this?
Morning, Georgie. Well, look, an investigation is underway to try and uncover how she actually contracted this virus. So that's a joint investigation with Queensland Health and the Queensland Police. They're combing through around 4 days of CCTV vision to try and pinpoint the exact moments when she contracted the virus, and also tracing the movements of a UK traveller who was staying in this hotel, who is likely to be the person who have passed on the virus. They have admitted there's a chance that they will never find out exactly when she contracted or how she contracted the virus, but they're hoping to use what they learned from this investigation to improve methods here to try and stop anything like this from happening again. So over the last 24 hours, we've had 3 new cases of the coronavirus in Queensland. 2 were returned travellers in quarantine already, and 1 was the partner of the hotel cleaner who first contracted the virus here. But 13,000 tests overall in the last 24 hours, and miraculously, Georgie, since the lockdown was first introduced, the hard 3-day lockdown, there's been 79,000 tests, over 79,000 tests in Greater Brisbane, and measures are still in place until next Friday. So for people living in Greater Brisbane, when they head to most indoor venues across Greater Brisbane, they will need to be wearing a mask.
Michael, thank you. And we're going to Melbourne now, where thousands of permits have been issued for people travelling into Victoria. However, so many are still stranded as well, Beth.
That's right. So as of 1 p.m. yesterday, the Victorian government had issued over 50,000 permits under its new traffic light permit system, which determines who can and can't come into the state. But we know that there are still thousands of Victorians who are stuck in Greater Sydney and Greater Brisbane, as those areas are still designated red zones, and the Victorian government hasn't provided any clarity on when they might be able to get home. So while there are thousands, tens of thousands of people who are now making their way across the border, there are still many that are stuck. But this all comes as Victoria recorded again yesterday 0 local active coronavirus cases, the 6th day in a row that's happened. So very positive signs for Victoria.
And Beth, it's looking like a gorgeous day where you are at Melbourne Park. And what are the final preparations looking like for next month's Australian Open? Will any of the players and staff be able to enjoy those kind of conditions for an extended period of time? What are the quarantine arrangements looking like?
That's right. Well, for the next 2 weeks, the players and staff will be living a very locked down and quarantine life and not enjoying the sunshine. The 1,200 players and staff are flying in tomorrow. They will have had a COVID test before they even get on the plane, and then once they arrive, they'll be put into 3 different hotels under quarantine for 14 days. They'll be tested daily, and not until a few days in will just the players and one other support person be able to leave to go to a designated training area. And we know that if anyone tests positive, they'll be immediately moved to a health hotel. So the Victorian government is calling this the strictest program in the world, and it's got good reason to be. They're very eager to keep COVID out, particularly now that our numbers are looking so good. And we know that UK variant, that highly infectious variant, is spreading globally. So the stakes are very high for this program to work well.
They certainly are, and we're just getting the breaking news in now as well. 0 locally acquired cases in Victoria in the past 24 hours, 3 cases in hotel quarantine. Beth Gibson, Alexia Attwood and Michael Rennie, thank you very much for your work this morning. And just repeating that breaking news that is just coming in, 0 locally acquired cases here in Victoria in the past 24 hours, 3 recorded in hotel quarantine, so excellent news.
Now, returning to our top story, doubts have been raised about Australia's vaccine rollout, with experts warning the AstraZeneca vaccine may not be effective enough to provide herd immunity. A number of doctors and immunologists are backing a call to suspend the planned rollout.
Meantime, GPs, though, have already been given the green light to administer the vaccine. Training is going to be offered from next week ahead of that planned rollout in February. Commonwealth Chief Medical Officer Paul Kelly joins us now from Parliament House in Canberra. Good morning to you.
Good morning, Georgie.
And when were you first made aware of these concerns surrounding the AstraZeneca vaccine, and are they justified?
The AstraZeneca is one of the vaccines that we're looking to get full TGA approval before we roll out any of the vaccines in Australia. That was a key part of the announcement last week that the Prime Minister, myself, Minister Hunt and Professor Murphy made about the vaccine program. We've been planning this for months, and we've been in negotiations with AstraZeneca for throughout that period. The great advantage of the AstraZeneca vaccine is it's being made here in Australia. It will be available as soon as the TGA gives its tick, which we expect that it will in February. I just want to make the point, though, that we're not the only country in the world that has AstraZeneca ordered. There are large orders. In fact, you could see that AstraZeneca is one of the mainstays of the global response and remains so. The UK has 100 million doses on order and they're using it now as an emergency use authorisation. In the UK right now, those vaccines are being used. The US has 300 million doses on order. The EU has 400 million doses on order. The AstraZeneca vaccine is effective, it is safe, and it's a high quality vaccine. But those are the things that the TGA will be looking at with their full approval coming very soon. I would say that the one thing that we do have in the public domain is the Lancet paper, the published paper on the interim results of their phase 3 trials, which was published a month ago, more than a month ago, on the 8th of December. I read it on that same day. I'm not sure why some people, I would dispute that they are the medical experts, are now disputing that particular set of data, but that's a small component of what the TGA will be looking at, and will be guided by their assessment of the vaccine.
So as it stands right now, what is the efficacy rate of the AstraZeneca vaccine, as you understand?
So from those interim results, they had several trials. They pooled the trial results, and the efficacy from those pooled results was 70.4%. But the range was from 62 up to 90. And so that was interim results in relation to the data that was available in November. We've had 3 more months of data that will be available to the TGA, and more data from the real world information that's coming from the UK in particular, who are already rolling out that vaccine. So we'll look at that, we'll wait for that. All the way along, we've been guided by the real medical experts in relation to immunisation, our Australian Technical Advisory Group on Immunisation. They are hand-picked experts on these matters. They've held us in very good stead for many, many years, not only in COVID vaccination, but all of our vaccination programs that we've rolled out, and the coverage is very high. So people should listen to those experts. We're listening to them, I'm listening to them, and that's what will be guiding our decisions in the coming months.
Well, as new data does come to light, and if that does determine that the AstraZeneca vaccine has the lower end of the efficacy, about that 62 percentile range, could we potentially have put all of our eggs in one basket here? 54 million doses on order. Is it too late for us to change a strategy?
We have several eggs in the basket. We have the Pfizer vaccine, which will be hopefully gaining approval within the coming weeks through the TGA process. That's well advanced. We'll have 10 million doses of that. That's enough for 5 million Australians. Definitely our priority groups can start on that as soon as possible after that tick is given by the TGA. We have 53 million doses, a bit over that, of the AstraZeneca vaccine being made here in Australia. There is no queue for that vaccine. We have that vaccine. It will be available for Australians, and every Australian could get 2 doses of that AstraZeneca vaccine. We also have a firm agreement with Novavax, another type of vaccine, a different type of vaccine, but targeting the same issue and very effective on what we know so far. That particular company did lodge an application to start that process of being regulated through the TGA yesterday. We expect to have good results from the phase 3 trials of that vaccine by Easter. So there are 3. The fourth egg in our basket, if you like, is the COVAX facility. We signed up to that very early, partly as part of our commitment to the rest of the world, a global vaccine program for a global pandemic. But that also allows us to purchase a range of vaccines that have been accepted by the COVAX facility, up to immunise up to 50% of Australians. And we're putting in our bids for some of those, and many of the vaccines that people have heard of are in that portfolio in COVAX. So we will have access to those vaccines as well in the coming months.
Well, if we leave our discussion about the vaccination rollout just for a moment and head to testing numbers, there's a lot of talk about those at the moment. Really quickly, where do they need to be and where are they at right now, right across all states?
Well, the good thing about testing numbers, and we've seen this now in several situations, in Victoria, in South Australia, in Queensland, in New South Wales on multiple occasions, when there's an issue, people come out. They come out in huge numbers to get tested. So that's a really important piece. Yes, we'd like it to maintain a higher level of vaccination, but we do know that the Australian public responds really well when they hear those calls for vaccination in particular places because of particular concerns. And so certainly at this time in Australia, I repeat what all the Chief Health Officers are saying, please, if you have even the mildest of symptoms that might be related to COVID, get tested. If you are requested because of potential contact with someone who may have COVID to get a test, get tested. The more we have of those tests, the better. The other thing I'll say about testing is that we're getting much better at using our genomic testing as well as the PCR testing, and that genomic testing is really assisting with the links between people and monitoring the arrival of some of these strains we're concerned about that are more transmissible. So testing is an absolute key. Please follow that advice.
We're hearing that message loud and clear. Commonwealth Chief Medical Officer Paul Kelly, thank you for your time this morning.
You're welcome. Thank you.
All right, let's move overseas now. Ireland emerged from a 6-week lockdown in early December with one of the lowest COVID-19 infection rates in the whole of the EU. But now the country is recording more daily cases per 100,000 people than anywhere else in the world.
Professor Kingston Mills is the director of Trinity College's Biomedical Sciences Institute in Dublin and says the jump in infections is linked to the highly transmissible UK variant.
The UK variant now accounts for between 30 and 40% of our cases here. And that's probably been here for, several weeks, long before they first detected it. It's almost impossible to stop transmission from the UK to Ireland because of the fact that the Northern Ireland doesn't have a border with Southern Ireland. So there's unrestricted travel. So we have undoubtedly got the Northern Ireland variant or the UK variant here, either directly from the UK through travel or through Northern Ireland. And this variant transmits more readily. And it is likely that it has some impact because in the UK also the numbers of cases have been going exponentially upwards. And that's thought to be as a result of this variant. So the variant certainly has had an impact on it, but probably the biggest impact is through the relaxation of measures over Christmas. So we already have started vaccinating with the Pfizer, and Moderna vaccine is arriving in the next day or two. And it has started with healthcare workers on the front line and people in long-term care facilities and nursing homes. So the pace of vaccination is quite slow. We're part of the European Union's rollout of the vaccine, and we get an allocation based on our population from the centralised European deal with the manufacturers Pfizer and Moderna. The AstraZeneca vaccine has been licensed in the UK. And the European Union are reviewing it at the moment and expect to make an announcement on the 29th of January. And it's anticipated that it will also be licensed for use in Europe, and therefore Ireland will be the recipient of probably around 3 million doses of that vaccine.